Hello, I'm Dr. Romualdo Segurola. The following informational video provided by St. Jude Medical will offer an overview of coronary artery disease. Coronary artery disease is the most common heart disease, and it is the #1 cause of death for both men and women in the United States. Healthy arteries are flexible, strong, and elastic. Their inner layer is smooth, allowing blood to flow freely. As you age, your arteries become thicker and harder, and plaque deposits may build up inside of them. As plaque builds, it narrows the coronary arteries, and it makes it harder for the blood to flow through to the coronary arteries, causing chest pain, shortness of breath, and fatigue. This hardening of arteries is called atherosclerosis or arteriosclerosis, and is the main cause of coronary artery disease. Left untreated, progressive coronary artery disease can lead to myocardial infarctions, which is also called a heart attack, or to sudden cardiac arrest. Your cardiologist will do a thorough medical history and physical exam and probably order diagnostic tests if coronary artery disease is suspected. These tests could include an electrocardiogram, blood test, or a stress test. The most definitive test for examining the coronary arteries themselves is an angiograph. Angiography is typically on an outpatient basis and is commonly called cardiac catheterization. During the cardiac catheterization procedure, a small catheter will be placed in an artery of your arm or leg. Using images from an X-ray machine, the doctor then guides a catheter to the opening of each of the coronary arteries. A small amount of dye or contrast is injected into the arteries so they can show up on an angiographic X-ray. A series of pictures is taken from different angles and views to locate all areas of blockage in the coronary arteries, which will enable the physician to make a diagnosis. Treatment for coronary artery disease is focused on providing sufficient blood flow to the heart and often is treated through a combination of methods, including medication, angioplasty with a stent, and coronary artery bypass surgery. Medication usually is the first line of defense and may be prescribed to control the symptoms of coronary artery disease and to slow its progression. Angioplasty is a surgical procedure performed to restore blood flow to the blocked arteries in the heart. During angioplasty, the doctor inserts a guided catheter into an artery in the arm or leg. Another catheter with a balloon tip is then inserted into the initial catheter and guided up to the blockage in the heart. The balloon is then inflated and deflated several times to compress the blockage and widen the narrowed artery. Your doctor may choose to keep the artery widened by placing a small wire mesh called a stent into the artery. After an angioplasty, you will be moved to a recovery area where you will have to lie flat on the bed for 4 to 8 hours to give the puncture vessels an opportunity to close completely. If the vascular closure device has been used, you may begin moving much earlier and you will be able to be discharged sooner. Another therapy for treating coronary blockage is coronary artery bypass grafting, also called CABG. CABG surgically places a vein or artery from another part of the body to bypass the blocked areas in the coronary artery. This allowed improved blood flow and oxygen to the muscle of the heart. After the procedure, you will probably spend 5 to 7 days in the hospital. Your doctor may choose to put you in a normal hospital room or a transitional care unit where you may begin cardiac rehabilitation. As your incision heals, watch for redness, swelling, or increased tenderness. Generally, your incision will feel better in a few days. Recovery from any surgery varies for each patient. Most patients start feeling better and gradually increase their activity in about 4 to 6 weeks. It is important in the postoperative phase to follow your doctor's instructions closely and to report any problems you might have immediately. As with all heart disease, lifestyle changes may be beneficial. Eating a healthy diet, staying active, maintaining a healthy weight, reducing stress, and not smoking all contribute to a healthy heart. Thank you for watching. This video was created by St. Jude Medical to provide information about coronary artery disease. This video is not a substitute for medical advice. If you have any questions, please talk to your doctor.